The field of prostate cancer care has completely revolutionized over the last 20 years. We've made so many advances in terms of drug therapy and in terms of radiotherapy and other treatment approaches. So why did we start Cure Prostate Cancer Canada? Most of the charities up until 2010, when we started the charity, really focused on bench to bedside clinical medicine, which means really a 20 to 25 year arc in terms of getting discoveries into patients and making a difference. And so we started the charity in 2010. And one of the first programs we decided to fund was this Prostate Advances in Comparative Effectiveness, or the PACE study. It was a study that randomized over 800 men to 5 treatments of radiotherapy using a higher precision technique that we were the first in Canada to develop here at Sunnybrook, and compare it to what was then standard, 20 or 39 visits to the hospital. The results have just read out in the New England Journal of Medicine, and it's a real game changer. This is going to revolutionize how men are treated for prostate cancer. The effectiveness of the treatment is the same for both groups, and we're seeing very minor urinary and bowel changes that are only lasting for a couple of months and require a simple medication that's well tolerated. So we're not talking about incontinence, we're not talking about wearing diapers, and we're not talking about taking lots of time off work for you to get through therapy. Essentially, you finish your treatment, you put your feet on the floor, and you can go play tennis. But we're not stopping there. We want to keep advancing the field. We've been on this journey over the last 24 years, from 40 treatments down to 25 to 5, and we want to keep going. So Cure Prostate Cancer Canada has also committed to sponsoring a 2 versus 5 treatment protocol. That 2 treatment program was also developed here at Sunnybrook and uses even tighter margins than we saw in the PACE study. We also have new technology, such as the MR-Linac, which gives us the ability to see and adapt treatment every single day. It's like having a custom-made suit delivered to you every single day. And we can actually target the radiation to the prostate with 0 millimeters of accuracy margin, which means we're not giving extra dose to normal tissues. So let me tell you more about what the next generation of 5 treatment approaches is going to look like. We traditionally treated patients with a machine that had a CT scan and a radiation treatment unit built into 2 parallel arms. What we have now is the ability to actually have a radiation treatment machine surrounded by an MRI, or a magnetic resonant imaging machine. What the MRI gives us is more detailed information about the soft tissues, specifically the prostate, the bladder, the bowels, and the nerves that control sexual function. So every single day, what I do is contour the prostate, contour the normal structures, and we actually come up with a plan right there on the spot, customized to that patient for that very moment in time. And it can be different every single time that patient's treated. So we can actually adapt the radiotherapy to the patient in that day. The next generation is actually going to be measuring biologic changes over time, so that we can actually take that information and how that patient is reacting to treatment and responding to treatment in real time, and actually make changes in real time to that patient. That's what the future of Prostate Cancer Canada is going to look like, and I hope that the Cure Prostate Cancer Foundation will make that happen.